What does it mean when the number of eggs that you retrieved at your egg retrieval does not lead to the anticipated or normal number of embryos? I'm Dr. Jessica Reinick. I'm a double board certified OBGYN and reproductive endocrinology and infertility specialist, and I'm going to talk about when things don't go as expected in the IVF lab. In order to know what is abnormal, first you have to understand what is normal, because there is drop-off or attrition from egg to embryo for everybody that does this process. And that's why IVF is such an effective treatment compared to other methods of fertility treatment, because we're maximizing the number of eggs so that we can narrow it down to the healthy embryos faster. This is what we call the IVF funnel. And so you start with a specific number of eggs. Of those, a certain number of them will be mature. And of the mature eggs, a certain number of them will fertilize. And then of the fertilized eggs, only a certain number of them will make it to the blastocyst or day 5, 6, or 7 embryo stage. If you do genetic testing, there might be one more little step of drop-off where a certain number of those embryos that you froze and tested would be genetically correct. Keep in mind, these specific numbers might vary a little bit by lab, so if you want the specifics to your embryology lab, you can always ask your doc or your team. So when there are issues with embryo quality, that can either come from poor egg quality or poor sperm quality or both. It also can be an issue with the lab, but that's less common, especially if you already know the statistics for your embryology lab. The following list won't necessarily be comprehensive, but these are some things that your doc might think about when thinking about why you didn't get as many embryos as expected. When it comes to the egg, here's a list of things that we might think about. So most commonly age and genetics, which are pretty interlinked, although there can be abnormal genetics even in young people. And so sometimes we'll do what's called a karyotype to look at the arrangement of your chromosomes. There are also things like endometriosis impacting egg quality issues, polycystic ovarian syndrome, if there's a degree of insulin resistance and elevated androgens, environment, so things like smoking or medications that can impact egg quality. And these are kind of the main things that we look at. Sometimes, unfortunately, we don't have a reason for why the eggs are of lower quality. When we look at the sperm, it might also be genetics, although that is less common than when it's coming from the eggs. However, if there's an abnormal karyotype, that's not the case. There can also be environmental factors, again, smoking, heavy drinking, drug use, or again, medications that can impact. And then we also look for potential of sperm DNA fragmentation. Best way to know what might be the issue for you is to follow up with your doctor and review the whole cycle. They hopefully will be able to have some insight into what the cause of this might have been, how you might test or how you might treat this to avoid this from happening again.